Not everyone with a cancer diagnosis undergoes a stem cell transplant, so this may not be relevant for you, but I know there are a couple of people watching who are gearing up to have one. It's a procedure mostly used in blood cancers like multiple myeloma, which is what I have, but also in some tumorous cancers like neuroblastoma and testicular cancer. There's a lot I don't recall. Some of that is due to the chemo they give you, and some of it, I believe, is just self-preservation. I blocked a lot of things out, but I will try to give you an idea of the process. Remember that I am not a doctor. This is just how I remember it. The hospital system I'm treated at doesn't do inpatient transplants. They believe that your chances of getting an infection is higher in the hospital than if you go home every day. There was an initiation appointment with a nurse practitioner who outlined what I could do and what I couldn't. For instance, there are microbes in the soil that can make you very, very sick. So I was not allowed anywhere near broken ground without a mask. We even had to keep the car setting on recirculated air. You can't eat certain things, touch certain things, you can't drive. John later said that that phone call with the nurse sent him spiraling mentally. He was convinced I was going to die. I'm not sure why hair loss feels like a big deal. It's just hair, but it does. Maybe more so for women than men. I don't know. For me, doing it in stages worked. I felt like I was in control of the process to a degree. John's hairstylist, a lovely woman from Iran, came to our house on her day off and gave me a buzz cut. In advance, I bought a wig. It is $500 I wish I hadn't spent because I wore it exactly twice. They are hot, they're uncomfortable, and anyway, everyone knows you've got cancer. I didn't care what anybody thought. A bald head was just fine. It made showering a lot quicker. They start you off with a bunch of tests, an EKG, lung function tests, blood work for infections, liver function, kidney function, and a bone marrow biopsy, which was not fun. Myeloma causes soft spots and holes to form in the spine. Oddly enough, I have very strong bones, no osteoporosis, which is great, but getting a biopsy needle through my hip or my pelvis, I think it was difficult. The doctor who did it said to me afterwards, the drill wasn't working, so I had to use a hammer. They also put in a central line, which is a long, thin tube that is inserted into the jugular vein, not the artery. Placing the line was fine. Taking it out was a completely different story. More on that one later. They start by giving you a large dose of high-intensity chemo called cytoxan. It damages DNA, causing the cancer cells to die. It also suppresses the bone marrow and weakens your immune function. That makes you extremely vulnerable to infection. Next, you have to give yourself daily injections of growth factors to stimulate new stem cells to grow and forces them out of your marrow and into your bloodstream, where they will be collected. The sensation in your pelvis is hard to describe. Every now and again, you get this feeling of a surge, like horrible sensation, but it only lasts a week. That's when you start going into the hospital every day. They keep measuring your stem cell concentration until there are enough stem cells to harvest. And that is where things get real. The most intense part of the process was about to begin. It would be 4 weeks of the most challenging time of my life. Look out for part 2 next Sunday. Thank you for watching.